Welcome to the DNA Talks podcast, where we take on the mission of unlocking the code of your genetics. This season is all about you, upgrading your health, not just on the surface, but down to the root cause. Join us as your clinicians at the DNA company investigate your DNA and beyond. The intention of this podcast is to enhance your lifestyle by changing what is in your control. This does not substitute the medical advice given by your personal doctor, therapist, and other healthcare professionals.
Bonjour, mes amis, and welcome to the DNA Talks. Today, we are here with Jen Goddard from Thriving Proof, and we are going to jump into some fun things. We're going to explore her own story of health and how she got into integrative wellness. We're going to be exploring genetics in her practice and in her health, in particular, how it's influenced her understanding of hormones and her patient's understanding of hormones. And then we're going to close off with a discussion of how can we empower you either as a patient or you as a doctor. We really want to speak to both audiences because we see, as both patient and practitioner between the two of us, we see both audiences and we see how wonderful genes can be in this space. So Jen, welcome. Hello. It is delightful to have you here today.
Thank you. Thank you so much for having me. I've been such a huge fan of the DNA company, so this is awesome.
Yeah. Well, I wonder if through that fanship, perhaps we can at least get started with your own story. So even before genetics, or perhaps alongside genetics, what initially sparked your interest in the holistic health space? What led you to what you're doing today?
Yeah. So I was super sick. I was young. I was in my early 20s, and I had lots and lots of health issues. The diagnoses just kept building and building. And I call it the new mom cocktail. I went to my family doctor and I got the new mom cocktail. I got the antidepressant. I got the sleeping pill. I got the anxiety medication. I got the pill to wake up from the sleeping pill because that wasn't easy. The normal list that you typically start out with. And then from there, things just started to grow. I wanted to have another child, and I found out that I was having fertility issues, and they diagnosed me with PCOS and endometriosis, and lots more fun things came from that, right? So I did infertility treatments with my second son, and that was just horrific. It was, we were forcing a body to get pregnant that obviously wasn't getting pregnant for a reason. So, and the pregnancy was very hard, and the birth was challenging, and his health after he was born was a huge challenge for most of his young life. And so that was all very challenging. And then my mother was diagnosed with colorectal cancer. And so they said, well, now with this severe family history, you should get a colonoscopy right away. Don't wait, get it now. So I was maybe 28-ish when I had my first colonoscopy, and there were tumors all throughout my colon. And I'm like, oh my gosh, like I'm doing something wrong. Like this is not the direction that I need to be, that I want to be going in. I'm not doing something right. So, but yet at the same time, I was doing all the things that they told me I could do and should do. So my sister was seeing someone that did muscle testing. And so I'm like, what do I have to lose? Right. Everybody starts with what do I have to lose?
Yep. So Hail Mary. Yep.
Exactly. The Hail Mary. I'm like, something's got to hit somewhere. So I went to see her and changed my diet and changed so many lifestyle factors. And all of a sudden, within 3 months, I was off of all my medications. I didn't even think that was a possibility, right? Because they tell you can't.
Yeah, and that's a quick titration off too.
Yeah, it was huge. It happened really fast. My body responded really, really well. And one thing led to the next and the next and the next. And before you knew it, I was feeling so great. And it just continued to grow from there. And then my kids were getting older, and I thought, well, what do I want to be when I grow up? So, and now here I am, right? Helping others do that too, because I want people to understand the power that they have, right? We're told there's nothing you can do, it's genetic, it's this, it's that, you always hear the genetic factor. Just because mom had it or dad had it, or there's some kind of family history, all of a sudden it's genetic. And you and I know that's not true. And I'm sure we'll talk about that. But it's hard to wrap your brain around the fact that you have power in every decision that you make, and one leads to another and another. So that's what I discovered. And that's what I want to help other people realize is the power that they have.
Wow. I admire that you transformed a story of my personal GP calls what mom disease that you just called worried well.
Right.
Insofar as you go to a GP and there's nothing specifically wrong, but also nothing as well.
Yeah.
And so to your point, I love that phrasing of the mom cocktail that's dispensed in kind of almost this new age band-aid style in the
Mm-hmm.
sense of nothing's right. And
Mm-hmm.
so here you go, here's everything. And so I love though that you took this story of it wasn't working and I'm not going to give up on that and I'm going to
Mm-hmm.
explore more and I'm going to find what works. And I find that for better and worse is an origin story amongst many integrative practitioners.
Yeah.
Yeah. So let's dive a little bit more into the genes because I think you picked up on something to me that's very interesting in that genes sometimes are villainized in that, well, don't bother doing anything. This is probably genetic. It's fait accompli. Like you can't do anything about it. So just
Mm-hmm.
don't. So
Exactly.
were you told that? And what was your turning point in your relationship with genes? Because audience spoiler alert, she uses genes in her practice right now. So they can't all be villains. How did you flip them from villain to Batman or, pick your favorite superhero?
Yeah, yeah. So when I learned about the DNA company and what you had to offer, we're our own guinea pig, right? When we're in this space. So, well, we'll start out with me and let's see what it says. And even though by the time I had done it, I had already figured out how to work with my body in a different way and didn't have any of these issues anymore. But even so, when you actually did my DNA report for me back in the day, in the very beginning, and what you had read off to me was like a transcript of my life without even knowing
Mm,
anything.
mm,
So I now had an explanation in a different way for what I
mm,
experienced, right? And that explanation was, yes, you have these genes. And if you're living the modern American life and eating the modern American diet,
yeah.
you're most likely going to have these issues, right?
Mhm.
However, as I proved long before even doing this, that
Yeah.
I no longer represented the profile of someone that was a diabetic. I no longer had estrogen issues. I no longer had any hormonal issues, right? So, and unfortunately, I could get pregnant at the drop of the hat now if I wanted to. So, sometimes it fits a lot. I guess the point is that, that it gave me a bigger way of explaining what I had already
Mhm.
experienced. And that was powerful.
So, to an extent, while your narrative had already been rewritten about your body and its ability to heal and to be well,
Mhm.
the narrative on both sides was really spoken to in your genes. The comment you kind of offered in the sense of you knew me before without even knowing me,
Mhm.
that crystal ball experience for better and worse is I find something that people often share with me when and I would imagine you get this too when we read into their genes and we already have insights about personality and tendencies of
Mhm.
body. Yeah.
Mhm. Yeah,
Yeah.
it's so powerful. And even today when I do it still, people are like, "Oh, well that explains this and well that explains that." And you have to make sure that you're offering the information in a way, and you did this very well,
Yeah.
in a way that just because it says this doesn't mean that is how it has to be, right? It doesn't have to
Yeah.
stay that way. And even though I didn't have any of those issues anymore, my genes still had that in black and white, and that didn't change, but yet my
Yeah.
physical health and my experiences and my lab work and all these other things were very different. So it
Hmm.
just hits you, that's not, it's not written in stone. It's not
Yeah.
something that's going to depict everything that you experience like we've been taught, right? So epigenetics is very powerful.
Your health journey speaks so strongly to this alongside the choice. You say choice after choice. Those choices culminate in how you're engaging with your DNA and what health is actually expressed. I think,
Absolutely.
you just shared that, while your genes have a predisposition towards type 2 diabetes, you do not have that. And what I like to offer people often is anyone can get diabetes if they work really hard at it. And,
Yeah.
following a standard American diet is arguably working very hard at it. And what that gene tells you is not necessarily will you or will you not, but more how quickly. And so if
Hmm.
you know you have a disposition within body to quickly acquire type 2 diabetes, there's more of an impetus to be changing diet necessarily than someone who doesn't have that with awareness. Someone who doesn't have that gene can ultimately get to the same end.
Absolutely. How people ask, sometimes they're struggling with, well, why did this happen so soon? Or my mom was this age before this happened, and now I'm so much younger. And why is this happening now? So it just helps to bring awareness, number one, and two, an understanding to where they can see the path in a much clearer way now because they have this extra information that they normally wouldn't be able to see.
Yeah. 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 And I would speculate that lends to a lot of aha moments
Mm.
with patients,
Yeah.
right? I
Yeah.
wasn't able to put my finger on this, but now that you've explained it to me, I do have that tendency. And now I can work with the tendency as opposed to this idea that somehow my body is fatally flawed.
Absolutely. Yeah. And
Yeah.
especially when it comes to the hormone pieces, they might not
Yeah.
be in menopause yet, but they're concerned because you hear comments, my mom was a lunatic. I am so scared, about
Yeah.
that time of life. And I say, well, you don't have to be scared.
Yeah.
Just having an understanding of how you function and how most humans function for that matter, when it comes to the standard way of living, it goes a long way. It makes a huge difference in what you end up experiencing.
Yeah. And I hear a little bit of philosophy of care when you offer statements like that, in the sense of it doesn't have to be the way it was of your mother, your aunt, your grandmother, whoever that might be. Can you talk to me about your philosophy of care and the philosophy of care within your clinic? Like, how did you stand that up?
Yeah. So the foundation is huge, right? So we always
Yeah.
work with people on their nutrition and their lifestyle factors. How are you sleeping? I love that DNA company has a whole sleep report, that helps them to understand that better, or why they helps them to understand why they may not be sleeping as well as they think they
Mhm.
are, that kind of thing, and what do they do about it instead of just shooting in the dark. So sleeping, breathing, right? If you're a mouth breather and how that impacts things. So you really, I tell people there's no one magic bullet. Not
Mm.
one thing is going to solve all your
Mm.
problems. It's a combination of all of these things because we've gotten so far away from how we should be living our life. Over the years, these smaller changes have led to this place where we're not even close to how, our body was made to function in a lot of ways.
Mhm.
So, we really have to bring it back there. And then using targeted nutrition that can be designed around your genetic tendencies, if that's something that they're doing. Looking at lab work from a functional perspective, not lab ranges, which don't tell us much anything in most cases. Things like that. It really has to be a full picture, a truly holistic approach in all of the ways. And then understanding
Yeah.
that there's a price to pay. If we want to drink alcohol, okay, that's fine. However many drinks you want, but you understand that it's like a bank account. You have a savings account.
Mhm.
If you want to make these withdrawals regularly, you need to make sure that the deposits are over here and understand the consequence of that and be okay with it,
Mhm.
that kind of thing. So it's
Yeah.
all of that.
I value that comment in the sense of it's not telling someone they shouldn't or can't drink. It's more the education of you can do what you want, but here are the consequences. And if you choose this, here's kind of that effort that you need to put into to balancing that.
Hmm. Yeah.
Yeah. And I also really like something you mentioned. Oftentimes I find when we sit in this integrative or preventative wellness space, in the longevity space, a lot of the time our counsel is similar to an extent in that we're always talking about sleep and exercise and good diet and stress reduction, all those fun things. And I often find patients and people will almost quit before they start, insofar as that's a lot to ask to kind of completely change your life to the end of living better. How do you go about that work of breaking it down and making that more accessible to people?
Yeah. Well, there's always more. If people say, I'll never be perfect, right? They always want to preface everything with, I'm never going to, you don't have to be perfect. I'm not perfect. We don't live in a perfect world. Perfect doesn't exist. Get that out of your head. Start where you are. And if you focus on the most common things that you eat and you address those first, and then, okay, now what are we going to do next? Now, what can we tackle next? Because it can be very overwhelming in the beginning, especially when you want to do well and we're trained to want to be perfect. We have high achiever mindset in a lot of cases. So it's hard to not want to do it all now. Right.
Yeah.
But understanding that this is a process and we're learning so much about who we are that we didn't know before. And enjoying that. And okay, I did this. I feel comfortable here. It's hard until it's easy. I love that saying. It's only hard until it's easy. So I tell people, when you were 3 years old, brushing your teeth was hard. You cried a lot, it was traumatic. I said, but now you don't even think about it, right? One, you understand the benefit. Nobody has to preach to you anymore. Okay, I got it. I get it, kind of thing, so it's the same concept, but in much smaller ways, whether that's your food, your lifestyle. I didn't get here overnight. I didn't start out where I am today. This is 20 years of gradually making small changes that led here. And I guarantee you that next year, my life's going to look even different than it does this year, because I've seen the results and the benefit from those things. And I don't ever want to go back, ever. I am a grandmother now. The fourth one's on its way. And I don't ever want to look back. I want to be here and I want to make the decisions and how I live my life moving forward. I don't want an illness or a gene or anything to dictate that to me, right?
Yeah. Do you leverage the DNA 360 and some of that guidance, in particular, prioritizing what is first on the docket of shifts? Yeah.
Yes. I love your reports and I love the information that it gives people, because in the beginning, like you said, when it feels overwhelming, you're like, oh, do I really have to do all of this? Well, this is why we're starting here. And this is why we're going to eventually get there. And it just helps them to see it in a manageable way and to understand the value of what they're doing with you, instead of thinking, well, she just wants me to take another supplement, or can't have that brownie, It's hard when you're in the thick of it. I shouldn't say it's hard. It's easy when you're in the thick of it to get stuck in those, brain pathways that have always run those loops. Right? We've got to get out of those loops. And a good way to do that is education. And the DNA reports give so much education that it makes it a lot easier.
Yeah. I wonder, this is a bit of a right turn in the conversation, but you and I discussed before this podcast, or you and I had a chit chat before this podcast. And I know in particular that when you're supporting people, a lot of our panels that explore hormones have been very pivotal, both to yourself as well as to your practice, right? So estrogen metabolism in particular, I know has been a theme of your work. I wonder if you can speak a little bit to that, because I think wonderfully, beautifully, female hormones, in particular, the menopause, perimenopausal transition, is getting more and more attention because it was something for so long that was relegated to, well, suck it up. We don't really talk about that. Yeah. So can you talk to me a little bit about your work in this space and how being empowered by genes has shifted that?
Yeah. So when it comes to things like, hormone therapy, I don't know where you are, in your area, but around here, hormone therapy is huge, whether it's synthetic hormone therapy or bioidentical hormone therapy, it's a big conversation these days. So that's one way where I tell people, if you're considering hormone therapy, especially, obviously we'd never recommend the synthetic versions, but if you're considering bioidentical therapy, then, hey, let's take a peek into your genetics first and see how well your body might manage that. So that's a great way. When we have, when people are considering birth control, that's a big decision. It's a hard one to make in a lot of cases. So, well, let's take a peek and see if there's something that we should be aware of now to make sure that we cross our I's or dot our I's and cross our T's, and make sure that this is something that your body will be able to manage if that's the decision that you make, that kind of thing. Menopause is huge. So many women, It's so sad to me because we've been taught that, again, there's nothing that you can do about it. It's going to be a miserable time of life and
Yeah.
you just have to figure out how to get through it. And I mean, there were a good 10 years of my mother's life that were all blamed on the change, where life was horrific for the entire family
Mhm.
of the change. So that's another big area where I
Yeah.
use it with menopause. It's a great instrument for helping people to understand the body they're living in, because what works for you isn't necessarily the same as your best friend or your sister even.
Mhm. I remember because I think I almost think of menopause to a certain extent a little bit like twilight birth, insofar as because we were encouraged not to talk about it for so long,
Mhm.
we've lost a lot of traditional knowledge, or at least that shared knowledge between mother and child, or like auntie and child,
Mhm.
something like that. And so it became this myth within culture and society and women that it, to your point, had to be horrible.
Yeah.
And I remember first being presented with studies of it was largely Japanese, occasionally Korean women, in the sense that they didn't really have that negative experience of menopause. And for a long time in the 70s and 80s, it was said, well, they must have a gene. Like there was this external factor as to like,
Right.
maybe it's because they eat soy, or maybe it's because they're Japanese, or it's probably something genetic. And I find it very interesting over the past, 10, 15 years, as diet and lifestyle in Japan have changed, unfortunately, more towards the Western way of things, they're starting to experience menopause in the way that we are. Right. And
Mm.
so to me, that tells me it's not a genetic destiny. It's not a destiny to have a horrible transition with menopause.
Yeah.
Instead, it's something, a byproduct that you have a lot of autonomy and control over.
Mhm. And our bodies were created to do this. It's like childbirth.
Yeah.
We were created to give birth, and it doesn't have to be this horrific experience. And how we go into that
Yeah.
is going to depict a lot of what we experience throughout the process, right? So the bigger our bank account, right, the stronger our reserves, and the better our habits and our mindsets, and whatever
Mhm.
we can accomplish leading into that, the better we're going to move through it. And in a lot of cases, not even think about what they're going through.
Yeah. Can you ground me in an example? So without giving any patient identifying information, can you talk to me about an example of a woman who came into your clinic who was maybe peri or menopause and not having a great go at it, and talk to me about your work and how that shifted her outcomes, shifted her experience of it all?
Yeah. So we also do something called thermography scans here. And if for those that aren't familiar with it, it's thermal imaging that can detect inflammation and that kind of thing. It's a great, some people use it in addition to mammograms, some people use it in lieu of mammograms, that kind of thing. So I had someone come in and she had a concerning thermography scan. And she kind of panicked a little bit. And she said, she came in originally because there was a history of breast cancer in her family and it made her nervous. So that's what led her to do this. And so I said, well, let's take a look at your DNA. We'll take a peek in there and see what's happening, since, most of this you're told is genetic, right? Let's see what's happening. And so we did that, and we learned how her body methylates, and we learned more about her sleep and how that's impacting things. And we learned more about insulin regulation and how she manages glucose and that kind of thing. We looked at estrogen factors, for her hormone report that was in there. That was huge. And she's
Mhm.
like, wow, this really makes it easy to do what I've always known that I had to do. And, we always say that, right? I know what I need to do, but I don't do it. And a lot of that comes from the value just isn't there, right? Because if it's something that has 100% value and 100% belief system, beyond a shadow of a doubt, you're doing it, right? You're not even thinking about it. So
Mhm.
if there's some reserve, some holdback, there's something there still. And
Mhm.
that really helped her put it into a perspective that it wasn't a fear-based thing. Like, well, my mom had breast cancer and had these issues, so I might as well, it's going to happen no matter what I do. So it doesn't
Mhm.
matter, so it took her out of that it doesn't matter space and put her
Mhm.
into the space like, let's go. I've got this. I'm all in, kind of thing. And it made a huge difference. Her follow-up scans, they improved every single time. She was able to monitor that progress, and she doesn't live in that fear that, overhangs us a lot of times. Like, is it going to happen today? Is it going to happen today? You know?
Yeah. Yeah, I love that story that and let's be plain, sometimes having a piece of paper that you can poke at and be like, see, look at this is
Mhm.
helpful, right?
Yeah.
Humans like very tactile things, but I've experienced that a lot in mental health care insofar as when people come in with an anxiety or depression, oftentimes they're educated it's like almost a moral failing. Like, why can't you just think your way out of this? You're fine.
Mhm.
Like, you shouldn't be this way. And then when they see that piece of paper that says, hey, you are, poor at creating your serotonin, you're exceptionally sensitive because of this noradrenaline pathway. Once there's a piece of paper, it's no longer a failing of the body or self.
Mm.
Instead, it's the way they're set up. And now we get to work with that differently.
Yeah.
Right.
I love that example too, because I was on obviously antidepressants, I said early on for a
Yeah.
long time, over a decade. And when I received my DNA, and they never really, worked or felt good. And so they just added another antidepressant and they added another, so the layering
Mhm.
thing. And when I got my report and it talked about how I would be a poor responder genetically to antidepressants, it was like, oh my gosh, this is why I struggled so much, right, with that.
Yeah.
And they just kept throwing another prescription at me and like, oh, we'll add this and we'll add this and we'll increase the dose. And it just was
Mhm.
this never ending cycle that never worked. So it
Yeah.
was, again, we can, like you said, in those situations, we can help people to understand their body. And if they're not sure if that's the road that they want to go on or not, well, let's take a look over here. And that might help you determine that if this would be a good fit for you or not.
Yeah. Yeah. I admire that time and education, the docera, if you will, of that you're with your patients. I think that's so important. I wonder if you can talk to me a little bit about the patient response. So if you present to them, hey, I want to run a genetic panel on you for, the reasons that we've just discussed.
Yeah.
What are the patient responses? Because I find nowadays genetic testing to an extent is a dime a dozen. Anyone and their uncle will run it for you, and there's also a lot of bad media, right? We all
Mm.
know what happened with the larger company, that's now in receivership or doing some business fancy footwork in order to stay after that, but with selling data and is selling data.
Yeah.
There's it's not exactly an easy sell. How do
Mhm.
your patients receive that, and how do you talk to them about it?
Yeah. So some of them have, their own ideas of what it may or may not be. So we definitely want to clear that up and make sure that we're on the same page there. Like, for example, some will say, well, my doctor did that. And I'll say, okay, let's take a look at what it was. And every single time it's been, and I DNA company I know has a test like this too, but how genetically, how well will you respond to different medications? And that's valuable information, especially if you're a
Mm.
prescribing doctor. And I applaud those doctors that are willing to take that extra step and dig a little bit deeper before they just write a script. So that has its place for sure. But so educating them that this is something that gives us different information is really important. They're generally pretty open to it because everybody's kind of curious, like what's under the hood, that, what can I not see kind of thing. So they respond pretty well to it. And it's just a lot of questions, right? And sometimes there are some security concerns that we have to talk about and, assure them there. But for the most part, people are pretty open to it because it helps them to identify what they feel like they can't see. Yeah,
Mm.
once you explain to them and I give them the sample reports in some cases, that's
Yeah.
really helpful. And they're like, oh, wow, I'm going to find out all that. I'm like, yes. So they generally
Yeah.
respond pretty well to it.
Yeah. Again, so it's those empowering conversations of
Yeah.
almost bringing yourself in as a collaborator is kind of
Yes.
what I'm hearing, as opposed to a dictator of sorts, where it's like, we'll do this because I said so.
Yeah, absolutely. At the end of the day, if they don't understand or if they don't believe in it, it's only going to go so far. And that's not going to help me achieve my goal. And it's certainly not going to help them get anywhere. So it really has to be a mutual understanding of value.
Yeah. Yeah. What I wonder, you've been practicing for a while, for a very long time on yourself, but separately with clients, with patients. I wonder if you can offer some guidance and some advice for the practitioners who are listening that are interested, maybe they're in the wellness space, the integrative space, and they're interested in adding genetics to their toolkit. And I speak from experience insofar as I appreciate a lot of providers can be very hesitant because it feels daunting. It feels like a lot, and they're not really sure the ROI on it. Do you have any advice or thoughts as to for someone who's considering bringing it into their practice?
Sure. It can absolutely be overwhelming. I mean, I don't know that we'll ever know everything about it, and that's okay to not have all of the answers, but these are
Mhm.
the answers that I can give you, right? And being able to help your clients, your patients, whatever you call them, and support them in that way, it's just another way to build up that bank account, right? And give them some perspective and bring some power back into it. Because even though you have these genes, it doesn't mean that you're helpless. It's not a death sentence. And this is what you can do about these things. So it gives you, as a practitioner, it gives you even more. I mean, we're all in this. Almost every practitioner I've ever met is in this because they've experienced some change, right, in their own health. And now this is what they want to help other people experience. So it just gives them another really easy way to do it. It's not expensive. And the
Mm.
data is overwhelming in a lot of cases. And you're like, there's no way I'm ever going to learn all of that. And that's absolutely true. But that's why you have other resources. My belief system has always been, I don't have to know it all. I need to know people that know things, right? So, and know the right places to get the answers that I
Yeah.
need for you. And you guys do a great job of the reports that you send out and the videos and supporting around it, so the practitioner doesn't even have to know it all, which is really nice. So just take that pressure off of you to have to know everything, and just say, hey, we're going to start where we start, and we're going to see what we learn through the process. And before you know it, it's going to become easier and easier and easier as you do the next and the next.
I value your practice philosophy and the humility that you have it with, in the sense of I don't need to know everything because there's a supporting network. And I hope for the providers out there they mirror this, because I think the future of medicine sincerely is a humility to I know what I know really well, and
Mhm.
what I don't know I'm going to engage my network for.
Yes, absolutely. The resources are so important. Know where to find the information, and you're going to be fine. And your patients are only going to do that much better, that much faster when you know. I
Yeah.
mean, if I had done my genetic report, if I had all that information in the beginning when I started, oh my
Yeah.
gosh, this journey would have been so much shorter.
Yeah.
Just because I came up with medications in 3 months does not mean all my problems were fixed that fast, right? So
Yeah.
things would have changed much faster for me in my health, for sure.
Yeah, I don't work in pediatrics on purpose, but I always encourage parents to be running tests for their children so that they have that foresight that they can start educating their child on, hey,
Yeah.
here's a weak point. Let's address that now and in a fun way, as
Yeah.
opposed to in the future when things aren't working, when the proverbial wheels have fallen off.
Yeah. I mean, that's great because, I tell people these are your opportunities. This is not where
Yeah.
your body is broken. I hate those words. I feel like they're really
Mhm.
powerful when you speak them. And it's like, well, these are where your opportunities are. And especially with kids, it drives me insane because they're like, oh, well, they recover. Kids will bounce back and they'll be fine. And just let them, live life until what? Until they have to figure it out the hard way. Until they have to unlearn everything that they've learned when they were younger and now relearn. That sounds really hard to me. I don't know about you, but it would
Yeah.
be much easier if I just learned, right? The right way leading up to it. And it doesn't mean they have to have a horrible, miserable life. Like this is not they're going to have a better quality of life. They're not going to have the attention struggles, that a lot of kids have in school. It's just, there's more to the story, and don't be afraid to read the book, basically.
Mhm. Yeah. And I feel like, and I'm curious if you've seen this in your practice, the duration of your practice, um, that philosophy of kids are resilient and don't worry, they have time, I think is detrimenting us insofar as, and perimenopause is a beautiful example of this. On average in the US, we used to see perimenopause. We'd say, 45 to 50 is when your body's going to start thinking about that. And even in the short course of my practice over the past 10 years, I've started to see that, with amongst doctors, we acknowledge, well, we start screening for it now in early 30s.
Mhm.
That idea that things will just kind of solve for themselves and pushing it off is
Mhm.
detrimenting our health, amongst many other things. I don't want to ascribe it solely to that, but I think that's part of it. Have you seen that in your practice, that
Oh,
issues that should be peaking later are coming down?
oh, absolutely.
Yeah.
The compounding of all of the different avenues that our body is trying to manage, whether you're talking about 5G or the environment or, our drinking water. I mean, how toxic is that? um, it's just horrifying, and our body's doing the very best it can, and giving it a little bit of grace and a little bit of mercy and a little bit of support along the way goes a long way in how you're going to live your life.
Yeah. Yeah. So Jen, I adore speaking with you, in part the empowerment and the positivity you bring to it, but also the wealth of knowledge. And I know you have some speaking engagements coming up, and I know that you and I are going to be chatting again before a few of them. But before we close off here, without giving away those presentations, what are you most excited about now in your practice and in the education that you're offering people? What gets your fires burning these days? Because it's one thing to say preventive wellness, but there's so many little avenues of that. What are you most excited about and focused in these days?
Yeah. So, there's so much, the political climate is a mess, right? And everybody is so fired up about all different things, and rightfully so. Things are a mess, whether it's, the chemicals in our foods and farmers and all of these important issues that we should be talking about and we should be working on. And what the government should do, our school systems and all of these things. It's just, we can talk all day long about what the government should do, and we can continue to fight that fight and work on that and make sure that things get better as much as they possibly can. But at the same time, we don't want to forget that the power lies at home and the choices that we make. And we still have a choice on our own. And every day that we make that choice, it's powerful, and it does matter. It does make a difference. And you can speak on that level before it ever gets to anything bigger. So, a lot of what I have coming up is, what can we do? Right? It's important for government, and it's important for regulations, and it's important for all of these things. But what can we do now that doesn't rely on that? That makes an impact. So again, it's very much about that empowerment piece, and knowing that we do have choices, we have options, and what you've been told as far as it doesn't matter is not true. It all matters.
I like that framing of empowerment, because I think, especially, saying things are chaotic feels like an upgrade. But I value that in a time where people feel very helpless, or at least a lot of
Yeah,
people I've spoken with feel helpless. This idea that you still have your day before you, and your choices can impact how you're experiencing the world. I love that. So thank you.
that's right.
Yeah. Jen, it's been absolutely delightful to chat with you today, and I'm very grateful that you are able to share not only your own story, but the story of your clinic, because I value the work that you guys are doing there, and in the name of empowerment, in the name of education. So
Thank
thank you
you.
so very much. Yeah, well, audience, we're going to make sure that in the liner notes of this podcast that we have a link to both Jen and her clinic, so that you know how you can engage with her, especially if you're looking for some of this support, be it your hormones, be it the empowerment, be it, making sure you can get off that mom cocktail. I haven't heard that phrasing before, but it both saddens me and delights me, in the sense of it exists, but we know a way out of it. So audience, will make sure you have contact to Jen. Jen, thank you so very much. It was such a delight to be able to reconnect with you, and in particular to kind of hear some of the ripples of that consult that we did so long ago.
Yeah. Well, thank you so much for all you do. And it started with you. So thank you.
Well, thank you. I'm so very grateful. It's as a provider, it's always nice to kind of have someone come back several years later and be like, this is what happened. And I admire what you turned all of that into, because that's not easy. It's one thing to know it, it's another thing to act upon it.
Yeah. Thank you.
Yeah. All right, audience, thank you so very much for joining us. Again, if you're looking to be in touch with Jen, please refer to the link that is associated to this podcast. And until next time, we wish you the best of health. Au revoir, mes amis. Au revoir.